Obstetric child with a fly limb. Risk factors for brachial plexus injury: large babies, shoulder dystocia, forceps delivery, breech position, prolonged labor. 90% of cases will resolve without intervention. Key to treatment is maintain passive motion while waiting for the nerve functions to return. The Erb's palsy happens because of excessive abduction of the head away from the shoulder. Nerve root traction injury. The limb is adducted and internal rotated, shoulder pronated and elbow extended, waiter tip hand. C5, C6 deficiency, deltoid, supraspinatus and bicep. Good prognosis and majority function will appear by 18 months. Poor prognosis if lack of bicep function up till 6 months. Klumpke's paralysis, deficiencies of small hands of muscle of the hand, claw hand, root injury C8T1, poor prognosis. Treatment: observe, maintain passive movement, nerve repair, grafting if no improvement by 3 months.